It's time for another podcast by George. Straight talk, straight from the heartland, that'll have you saying, "By George, I think he's got it." Now, here's George.
Hello, hi, how are you? Welcome on in to another podcast by George. We're continuing the podcast here on the coronavirus 2020, the COVID-19 shutdown. I'm still on self-quarantine, not going a lot of places, just kind of living the dream here in retirement, doing my morel mushroom hunting, riding my bicycle, spending time outdoors, doing some gardening, and staying the hell away from people. And I hope other folks are doing that as well, and we can continue to flatten this curve. And I don't know exactly where we are on this. You've got to look at the data. You've got to talk to the professionals, and that's what we're going to do here today. We've got our good friend, Dr. Andrew Nish, on the podcast by George Live Line. And, of course, he's the medical director of the John Stoddard Cancer Center here in Des Moines. And I'll just give this a quick update here. Now, I'm recording this on Thursday, May 7th, and this is what I'm seeing. Another 12 people with COVID-19 died in the state of Iowa. The Iowa Department of Public Health is reporting the statewide total now at 231. The IDPH is also reporting that 655 people have tested positive for COVID-19 in the last day. The respiratory disease is caused by the coronavirus, of course. It says statewide thus far, 11,059 people have tested positive. And Dr. Nish, first of all, welcome back to a podcast by George. Really appreciate this.
Thanks, George. Good to be here.
And you're looking at this data. How are you analyzing it? What's your perspective on it right now?
So our team at the hospital, and I'm not intimately involved, I do keep up on our numbers. We really look at, what are the number of new diagnoses per day? What are our new admissions per day? How full is our hospital? So in the Des Moines area between Methodist West, Central Downtown Campus, and Lutheran, we have just over 700 beds of capacity. We were running around 380 to 400 inpatients. We're now, I didn't look at the census today, but close to 500. So we still have buffer room. We did open up elective surgeries yesterday. So we opened up surgeries running at about 50% capacity. And one of the stipulations was if you couldn't have more than 10 admissions per day coming out of the OR. So we still have capacity for patients. Our ICU is not full at this point. But it's still a bit disturbing as our trend continues to climb. I mean, we had 408 cases 2 days ago, which was the most in any day. We continue to see more deaths. So we have not hit the peak of this.
And that's really the critical part of this. And there's a lot of criticism being directed at our public officials, our politicians, basically, that have been in charge of this. And I kind of wonder about the efficacy of that. Like I say, I don't know. When it comes to life and death matters, I'm not likely to turn to a politician. But that seems like what we're doing. They're making the decisions. They're reopening. How do you feel about reopening at this juncture?
I think we're doing better than a lot of states, frankly. I wish we would just kind of stay quarantined, stay at home for a few more weeks. I just think that we're going to, I happened to go somewhere this morning. I had to run and get something and couldn't believe the number of cars in parking lots. And my fear is that we're going to see another spike in this. And, we haven't even hit our peak yet. And it's now projected we won't hit our peak for maybe another month. Nobody's sure. So I think this has got to be a really well thought out gradual process. And one of the big things that we have to be able to do is we just have to have more testing capability. We have to be able to test people. And so, for example, somebody I know has coronavirus. None of her family members were symptomatic. We have absolutely no idea whether they had the coronavirus or not. And so in those cases, everybody should have been tested. You were exposed. Did you get it? Did you have an asymptomatic or a very mildly symptomatic case? Because they could be walking around mildly or asymptomatic, shedding virus. So until we can improve our testing capabilities so we can test anybody who is exposed or anybody who has symptoms, I don't think we should be rushing to put people back to work and out in society, really.
God, I wish we weren't either. I mean, this is a national emergency. It's a pandemic, for God's sake. And thinking back in history, think of the people, in the Blitz in London living in basements, hiding out from the bombs. My God, they did that for months and months. But here, the way things are and the way that we live and the way that we are as people, I think the short attention span theater that is America, and I'm very critical. I'm cynical. I mean, it gets to be, and it has to do with my age. Maybe I'm kind of a grumpy old man. Maybe it has to do with drinking coffee in the morning. But I think people are going to go out. I mean, I think it's going to open up. I think that the self quarantine is going to end here very soon. 11,000 cases here in the state of Iowa, and of course that's with the very limited testing that you're talking about. And I could talk to you about so many things, but since you mentioned testing. What about, and we talked about this a little bit in the last time, or in our last discussion, you have this this COVID that can morph, it can change, and it's doing that, right? We're getting different strains of this.
Well,
are we testing for the same thing that we were testing? Tell us about that.
That's a bit of a misnomer. It has not morphed or changed into something that's different. And so it's still one virus. It's behaving the same in everybody. So we don't have multiple different viruses labeled under Corona-19. Now, every time that virus enters somebody's body and replicates, it may change very slightly, but that doesn't mean it's a different strain.
I see.
So as of right now, we really, in reality, have one strain. But what we don't have is, and again, people have to understand this, we don't have a good treatment. I mean, there's lots of people testing things. There's some antiviral medications that are being tested. Our president has made hydrochloroquine famous, but none of those treatments have been proven to be effective. So we don't have a good treatment. And even if we do have a good treatment, that may only reduce the mortality by about 5 to 10%. It's estimated. It does. Some of the drugs are showing a decrease in the time it takes to be well again, but there's no panacea drug out there that's going to cure the coronavirus. We are months, probably years away from a vaccine. We talked a little bit about a vaccine, and yes, vaccines are trying to be fast-tracked, but even fast-track could mean 12 to 18 months. The other thing that's been out there is, the coronavirus is going to go away with warm weather. Well, that's just nonsense. I mean, it's not going to go away in warm weather. It's still going to be here. And I think the real worry by public health officials is if we don't really contain this contagion that's going on now, we're going to see a real problem in the fall and early winter again, which will coincide with the new flu season.
Well, and as you know, and medical professionals know all too well, it's particularly catastrophic to older people and people that have underlying what they call comorbidities and people that have weakened immune systems. And now we're kind of coming back into your world, and I wanted to talk to you about that. I mean, you're the cancer doc. You're the head of John Stoddard. What about people that have cancer and are being treated for cancer with chemotherapies and radiologies and all these type of things? Aren't they in that category of weakened immune systems that are particularly at risk?
Yeah, absolutely they are. In fact, there was a paper published a couple of weeks ago out of Wuhan, China, and they looked at cancer patients, and what they were trying to answer is, do they behave differently than someone else? And the answer is yes. They're more likely to get infected. They're more likely to have a serious infection, and they are 2 to 3 times more likely to die. So we are taking every precaution at the cancer center. A lot of our patients are being seen via telehealth, Zoom, for example, so they don't have to come into the office. And that's been particularly useful for just routine follow-ups. If patients need CAT scans or they need labs, they're going to the lab, getting their blood drawn, they're going to the radiology department, getting their CAT scan, but not going back to an office. They're having their results told to them over the video conferencing. And if people do have to come into the office, they are screened. So they're screened temperature, symptoms, and things like that. And so we're taking those precautions, but we are really trying to keep our cancer patients out of the hospital for 2 reasons. Number one, to keep beds available, but number 2, keep them from getting exposure to this virus. So I would say for all cancer patients, they should really take staying at home and quarantine very, very seriously.
And then they need to do something. We talked about this also on the, the psychological side, the mental side, because the cancer treatment, the procedures, the diagnosis itself can be debilitating for these folks. They've got to keep a positive attitude, right?
They do, and it's been really interesting because when you're in the hospital, you haven't been able to have visitors. When you go to an appointment, in some of our offices, you can have one visitor, but it can be a lonely experience right now. And so last night I did an online Zoom thing for Above and Beyond Cancer, and we had people watch about a 27-minute video by John Kabat-Zinn on meditation. And then we had an hour and a half group discussion on meditation and mindfulness and how that can be extremely useful in stressful times like this. So we are trying to, continue programming online to engage people and make people feel part of a community and not feel quite as lonely.
I mentioned that phrase, that term, and so many of these phrases are, they're becoming part of the, commonplace language of the day now because of the pandemic. But comorbidities.
Yeah.
And a lot of people might think, well, that's something you can't do anything about. But actually, you've got a prescription, and you've always had prescription for reducing the likelihood of a comorbidity, right?
Yeah, I think that's a great question and a great segue into a topic that's near and dear to my heart. And that is, we have a nation that's sick. So we have 75% of people in this country who are obese or overweight. We have over 30 million people with diabetes. Hypertension, high blood pressure is in the 60 to 90 million people range. And these are people who have increased susceptibility to this virus. And it really points to our nation as being very sick. I mean, our mortality rate is significantly higher than many nations who are going through COVID right now. And I think a lot of it's due to our comorbidities. And this is a real opportunity to reassess our health, because our health is not good in this country. And people are dying. And those people who are dying are people who already have these pre-existing conditions. And I think it gives us a real opportunity to assess, okay, what is health and how can we really improve our general health so that next time a virus like this comes, and believe me, it will, okay? I don't know if it's 5 years, 10 years, 20 years, we can be better prepared from a public health standpoint, but also a general overall health standpoint in this country. And so it all goes back to, what you're eating. Are you eating junk food or are you eating nutritious foods like fruits and vegetables? How are you sleeping? Are you sleeping well or are you up all night? How are you exercising? How are you managing your stress and your mind with either meditation practice, mindfulness practice, whatever it might be? How are you managing relationships? And these are all so important in general health. And I think it's a great time to maybe adopt some new habits. People, I think they're anxious, and they're anxious because there's a lot of uncertainty, but we always look at uncertainty as something bad. I kind of like to look at it as, let's embrace uncertainty, because uncertainty can lead to very, very positive changes. And so I think we should really look at it as uncertainty as a pathway or an invitation to grow and improve, and not just look at it as a catastrophe. We always want to, everybody says, well, when are we going to get back to normal? Well, I ask them, what is normal? There is no normal, right? The only certainty is life is uncertainty and change. So let's use this time to reflect on what's important to us in our lives and what isn't. And maybe we can begin to reprioritize the importance of family, good food, enjoying nature. I'm outside, okay? I'm outside, I'm enjoying nature. And not prioritize so much as, I need to make my 5th trip to the mall this week. So I look at it as a real opportunity for people. And people get nervous being at home, but I want people to reflect on life and reflect on things are the way they are, and that's it. and you can't change it. So use it as a growth opportunity.
Well, use it maybe as motivation also. The other thing is adopt these new habits that you're talking about. I just love this stuff. Also, my God, a bad habit, smoking. I know it's tough. I mean, it's hard to give it up, but if you ever needed a reason or another motivation to make another shot at kicking the habit, smoking that is, this is the time, because this thing attacks the lungs. And if you have a compromised respiratory system because of cigarette smoking, man, that's a real serious, that's a problem, right?
Yeah, I mean, people who smoke cigarettes, people with cigarette-related diseases, including lung cancer, emphysema, have a significantly higher death rate from this virus.
I heard that's why it hit Italy so hard and so fast, was because they have such one of those countries that has a lot of smokers over there. Well, I had some.
Well, and they have a lot of older people. They're one of the oldest countries in the world as well.
Yeah, and again, it has to do with if they're living at home with other family members or living in group homes that are, small with a lot of people in them, and those types of things as well. I had some quick hitters kind of that I wanted to hit you with some quick questions here. And one thing's been very frustrating for me, man, it has to be for you too. A lot of people really struggle with this asymptomatic part of the coronavirus. And the idea is, well, if you're in a workplace and somebody contracts it, the people that have been in contact with that, they're all right as long as they don't have a fever and they're tested and everything is cleaned up and business can just proceed as usual. But the fact of the matter is, as I understand it, because this can be carried asymptomatically, people can be infected and not ever know it. So if you have a person go down with it, that doesn't mean that everybody around them's okay as long as they don't have a fever that day, right?
Why we need more testing. I mean, if you are in a situation where a coworker has had corona and you've been exposed, you should absolutely be tested. And the other thing we're learning, this paper just came out on this, is with this old SARS virus that popped up a number of years ago in Eastern Asia, people were most contagious later in the course of their illness at about 5 to 7 days. We believe with the current coronavirus, people are most contagious in the asymptomatic phase and 1 to 2 days into the symptomatic phase. So we're dealing with a little bit different animal as far as, when peak contagiousness is. And so we have got to do a better job at public health testing. And like if you're exposed in a work environment, frankly, my opinion is everybody should be tested.
Highly contagious. Yeah, highly contagious as you mentioned. And can you dispel the myth one more time? I hear this all the time too. People say, "Well, it's just like the common cold. It's just like the flu." This is not like the common cold or the flu.
No, if you look at the flu, so there's something called an R value, and it's how if you have the virus, how many people you're going to pass that on to. And the flu is about 1.5 to 1.7. The COVID is about 2.2 to 2.3. So that means for every infection, it's going to get passed on to 2 to 2.5 people. That's why we have this exponential increase. In order to get rid of the coronavirus or slow it down, we've got to have an R value less than 1, and we're not there yet. The other thing about it is the mortality rate. So the mortality rate of flu is about roughly 0.1 to 0.15%. The mortality of corona, we think, is probably 2 to 3%, but could be 5%. So there's a significantly higher mortality rate with the coronavirus. And that's why it isn't the flu.
Yeah. And there are varying degrees or levels of illness, but I don't know. It's my feeling, understanding that even if you don't die from it, even if you survive it, some people are going to get really sick. We're not talking common cold sick or even flu sick. We're talking knocking on heaven's door sick for a lot of these folks.
Yeah, and we're learning more and more. We first thought it was respiratory, and now we're realizing it can attack any system in the body. So we're seeing heart dysfunction related to coronavirus. So we see what's called a cardiomyopathy and decreased heart function. We're seeing kidney problems with coronavirus. We're seeing skin problems with coronavirus. There's something called corona foot, where you see these little sores on people's feet from coronavirus. So as this virus progresses, I don't think we've seen an organ system that's spared at this point. And, you know, we're going to document more and more organ systems involved, and we'll understand this better and better as we go on. But it's still a learning curve for everybody.
And I got to say, I actually was real early on in reporting on this because I had a young ICU nurse in Atlanta, Katie Ostad. And, she's not an old salt, but she's been around long enough to have seen a lot of cases and a lot of illnesses come through her ICU down there in Atlanta. And, of course, they were really hard hit. And what she said on my podcast that really made me sit up and take attention was exactly what you're talking about. She's never seen an illness that presented itself in so many different ways, with people coming in, like you say, not just with a cough, which is what we all heard to begin with, but all of these other various and sundry maladies, which were COVID-19 related.
Yeah, there's one syndrome that's been described mainly out in New York, and that is strokes in young people. So the coronavirus is what we think is binding to the cells that line blood vessels called the endothelium, and it's causing problems with the endothelium, and that's really important to prevent blood from clotting. And so we're seeing strokes in young people from the coronavirus. So lots of scary stuff out there. And I don't want to scare anybody because that's not what I'm here to do. But I want people to be aware that this is a serious illness, and still the best way to avoid that illness is avoid contact. And that's just, staying at home, enjoying whatever, your home, your family, your yard, your dog, walks, and just stay away from crowds.
Yeah, go outside and enjoy a little of what I see behind you every time we ring you up on the podcast. I love that. The birds that are in the background there. Go out there and listen to the birds. That's good for you, for the body and soul.
Yeah,
I mean, check it out.
I know it's spring. The Baltimore Orioles are here.
Yeah, we've been enjoying those as well. And I got news for you, folks. If we don't do what the doc is saying, if we don't treat this appropriately, those birds will be singing long after we're gone. So, self-quarantine.
Yeah, one of the other, I want to address one other myth that, we've talked about, some myths of coronavirus.
Yeah.
The other one is face masks. People think, I got a face mask on, I can go do anything. And that is not correct. Okay, a face mask is designed to decrease your exposure to the virus. It may filter out, we're not sure how much, 40%, 50%, but it is not a substitute for social distancing. So, face masks are good. Face masks, despite the vice president and president, are mandatory in stores and hospitals and should be worn when you're out, but they are not a substitute for keeping your distance from people at this point.
Well said. And maybe the last question from me. I interviewed an ICU nurse in the Bronx, and she talked about the fact not only have her coworkers been infected with this virus, some of them have died out there. Now, I know none of your coworkers have died here. Has there been any infection amongst the medical professionals?
There has. Yep. It's not great, but yes, there has been some infections amongst medical professionals. And in fact, my in-laws live at one of the retirement centers here in Des Moines, and one of the healthcare workers there was tested positive the other day for COVID.
And is there any way to know how that happens, or would it just be guesswork?
No, that's another, so it's called contact tracing. And we have got to be better at contact tracing. So we have got to improve. If somebody like a healthcare worker at the retirement home had it, we have got to be able to trace backwards her contacts and figure out where did she get that from. And I think that we're going to rely a lot on tech for that. And some people are going to view that as an invasion of privacy, that they're following me or whatever. But in order to help control this pandemic, that's going to be essential. China's done it. Singapore does it. I mean, different countries do it. And I think, we may have to give up a little of our, quote, freedom to help out with this.
All right, Doc, and I think we're going to check out for today, to use some medical nomenclature, and I hope we can check back in here soon, because I really appreciate this, and it's good information, and I'm learning just listening to you. Anything here in closing that you want to say before we sign off today?
No, I just still want to emphasize that I want to emphasize to people that you should continue social distancing. We should not be opening up large venues. I don't think you're going to see large venues opening up for a long, long time. And use common sense. There's so much out in the internet that just is nonsense. The other day it came up. Let me give you an example. At the retirement home where my in-laws are, they're now spraying, if you bring a bag of food, they're spraying the bag of food with Lysol. Well, when you look at the science, that makes absolutely no sense. There's a very, very minimal risk of transmitting the virus on a packaged food good. We have no documented cases of that happening. The best thing to do is if you touch a bag or touch something from someone else, that you empty that bag, and then before you empty the bag, wash your hands. Empty the bag, put your food on a plate, throw all that packaging away, wash your hands again, and then eat your dinner. But spraying bags with Lysol is just, we do things because we think we need to do something. The reality is the best way to prevent this is stay away from people, social distance, and wash your hands after touching anything.
All right, that's great. See, just like I said.
Simple.
We learned something. Yeah, common sense, simple.
Common sense. Yeah, we've lost common sense in this whole thing.
Folks,
can I say one more thing?
Please.
You shot me that article about virus particles on air pollutants.
Yeah,
that was another one that is really, just because we find a virus particle on an air pollution particle does not mean that air pollution is a contagion. Okay? There's not a cause and effect there. And so we have to really look at these studies in the context of, is this really causing illness to the human population? And finding a virus particle on an air pollution particle is not causing coronavirus to spread.
Yeah, and that was like a really scary scenario. I think that was somebody in Italy that came up with a little piece of data and put it out again on the internet, and it really makes you raise your eyebrows and might scare you to death, scare the bejabbers out of you. But like the doc says, there's probably not. There's many more things to worry about and things you can do something about, particularly other than that. Yeah. Well, that's great. Thanks again. That's Dr. Andrew Nish, folks. Now, he's the medical director, John Stoddard Cancer Center here in Des Moines, Iowa, and a guest and a friend of Podcast by George. And if you like hearing from him, if you like this podcast, please subscribe to us on YouTube. Give us a thumbs up there. Click the notification bell so that you find out about future podcasts. Follow us on Facebook. A lot of folks do that. We get hundreds of views on Facebook and really appreciate that. But of course, we're available as audio on iTunes and Spotify and places like that as well. But that's going to wrap it up. We'll be back soon. Thanks for checking it out. That's another podcast by George.